My name is Gavin and I work at Moorfields base in St. George's, and I'm working as an advanced nurse specialist. After being selected to be a nurse injector, and after 2 or 3 years, I've become the injection lead for the South. And also it has helped me to teach others my technique, and in the same way that I see the patient, I pass on the experience and the knowledge that I've gained over the years to others in order to do pretty similar to what I've been doing. Since being an advanced nurse specialist, I've been able to train 6 more nurse injectors and across the South, and also I've been teaching and doing training for other nurse injectors who wanted to work as a nurse practitioner. Since I've been doing this role, one of the key changes that I've put in place is to play jazz music, and 99.9% of the patient, they are more relaxed when they come to the injection room. As people can imagine, it is quite a traumatic experience to have a needle stuck in the eyeball, but as soon as patients come in the room and they hear the music, they calm themselves down. And obviously when they see somebody regularly, because those patients tend to come back every 4 to 6 weeks or up to 10 to 12 weeks, and they see the same person delivering the treatment to them. So over time, we start to build a relationship. So then that's why patients tend to request certain staff to do their injection, as this is quite a delicate and frightening experience for the patient. Whenever I'm working in clinics, a lot of the patients tend to request for me to do their injection, which gave me great pleasure and satisfaction to do that. It's been a massive privilege and honor to be able to be the one that actually give the treatment to the patient instead of the doctors, because as the nurses, we have certain limitation, but this role has helped to cross that boundary. And this is the biggest satisfaction that I get every single day when I inject patients. In my experience, since the nurses has taken over this role, we've noticed a shorter waiting area for patients coming to the clinic. In the past, it used to be between 4 to 5 hours from the time they check in and the time they go home. These days, the patients stay around 2 to 3 hours. And in some clinics, within an hour and a half, patients are seen and they have the treatment and then they go home. So the patient experience coming into hospital and not having to wait such a long time has improved a lot, and our DNA rate has reduced quite a lot as well. So with the increased number of patients, we've managed to set up the clinic pathway in a way that the patients are seen quite swiftly. As soon as they come in, they get seen by the technician, and then once they've had the diagnosis done and the assessment done, then they come to the nurse injectors. And this is the critical time that, as a nurse, is very important to relax our patient and to make them feel less anxious and not frightened when they come into the room. So having nurses to do this role, I've seen over time that patients are more relaxed, and then they enjoy the relationship a bit more than they used to be. My next step is to be the next nurse consultant for Moorfields South, which is something that I'm already undertaking. Well, I'm planning to do a master's in order to achieve this role.